Please see the link in the description to download a worksheet for this video. This video shows X-rays and other images that were taken of healthy people. Nobody was hurt during these images. There were no operations, so there is no blood or direct views of organs. But viewers who are sensitive to the life sciences should have an adult who is not sensitive to this content view it first, to be sure it is suitable for that viewer. This video is intended for students in high school or beyond, since there are images of a beating heart. Younger viewers should have an adult view it first to ensure it is suitable for that viewer. If you have not already watched the prior video, we suggest that you view it before watching this one. Animations and 3D models help us learn what organs would look like if we saw them during an operation. But nowadays, healthcare providers see organs much more frequently using indirect means, such as with advanced imaging technology. We'll start by reviewing the four most common means of seeing internal organs. Then we'll demonstrate what organs look like using these methods. Once the patient is positioned, a typical X-ray requires only a few seconds to take. They are fast and expensive and excellent for evaluating bones and common problems, such as a cough. Some are portable, so can be wheeled around a hospital as needed. As the name suggests, an X-ray machine emits a wavelength of electromagnetic radiation called X-rays. Their downsides are that they are limited in their ability to see soft tissue organs, and they emit radiation which can be harmful in large amounts. An ultrasound machine is a small device that is easily wheeled where needed. The operator controls a computer which has an attached probe that is covered with gel, then placed on the part of the patient where the imaging is needed. As the name ultrasound suggests, the probe sends sound waves into tissue. Then it listens for their echoes, and the computer can make an image based on those echoes. The technology is very similar to how dolphins and bats can sense their surroundings in the dark and how submarines use sonar. Like the word sonar, the images made by ultrasounds are called sonograms. Ultrasounds are the opposite of X-rays in the sense that they are worse at looking at bones, are better at looking at soft tissue organs, and use no radiation, so have no risk of radiation harm. Ultrasounds get real-time images including motion, so are often preferred for looking at the heart beating, in which case they are called echocardiograms. A CT scan is the common abbreviation for a computer-assisted tomography scan. This uses a lot of X-rays and is good at looking at both bones and soft tissues. These typically take several minutes to complete, and they are not portable. There is a lot of radiation from a CT scan, so we use these sparingly. An MRI is the abbreviation for magnetic resonance imaging. The machine is similar to a CT scanner in how it looks, but it has a longer tube. Unlike a CT scan, an MRI uses magnets to generate images, so there is no radiation, so it is considered safer than a CT in that regard. MRI machines can image both bones and soft tissue, but they cannot be wheeled around a hospital. Ultrasounds, MRI, and CT scans get images in a plane. We can think of a plane as being a very thin section that is imaged. We call these thin sections slices or cuts. Of course, in reality, there is never a slice or cut, since this is just a way to look inside the patient without doing surgery. Here is a side view X-ray of a partially bent knee and a front view of a straight knee. We can see the femur, patella, tibia, and fibula. But the soft tissue is just a white blur. We cannot see details of the soft cartilage, muscles, or ligaments. This is an MRI of the knee with a sagittal slice through the middle of the knee. We can see much more detail, including soft tissue structures. Here is the same knee but looking at many sagittal slices, starting on the outside of the knee and moving towards the inside. This is a real-time MRI showing a knee bending and straightening. Sometimes we make 3D images of organs by using a computer protocol that combines views from many slices. This knee image was made using many images from a CT scan. This is a sagittal slice of a normal head CT. The thin yellow vertical line on the small image shows us where the slice is taken from. Here is the image with some structures labeled. This is the full set of sagittal images, starting on the right and moving to the left side of the head. This is the same head CT but displayed using transverse slices. This is the plane that the CT machine uses to acquire the images. And here is the same head CT, but this time displayed using coronal slices. This is an MRI of the brain without and then with some structures labeled. Compared with a CT, an MRI is better able to distinguish details in the brain, but may be worse at showing bone details. These are sagittal images of a neck MRI showing some brain structures, the spinal cord and bones in the neck and upper back. This is the full set of images. You may have heard of people having a slip disc that refers to the discs between each vertebral body. This is an MRI of the lower back showing similar structures. This is an abdominal X-ray. As with the knee one we saw previously, abdominal X-rays are not constrained to one plane, so we are seeing everything in the abdomen. The bright structures are bones, but we can barely make out any soft tissue organs. This is an abdominal ultrasound focused on the liver. We are seeing many transverse sections of the liver as the probe is moved inferiorly from a level near the chest to a level near the waist. This view shows some of the right kidney. In a separate view, we can see the gallbladder. Here's a CT of the abdomen with a slice in the transverse plane. The small image shows us where the slice is taken from. We've labeled some of the structures, as seen in both the transverse and coronal planes. This is the full set of transverse slices, going from the bottom of the chest to the waist. Sometimes doctors need to focus on the blood vessels or bones, so they use an image like this. Imaging programs are so advanced nowadays that they can make 3D images based on the transverse slices acquired by the machine. This is a transverse slice of a chest using a CT scan taken at the level shown in the small image. We've labeled some of the major structures. Here is the full set of transverse slices starting above the shoulders and extending to a level near the umbilicus. This is a real-time MRI of the chest in a coronal plane with some major structures labeled. To inhale a breath, the person's diaphragm contracts and temporarily pushes down the abdominal organs, thereby increasing the volume of the chest and creating a suction to pull in air. We can also see some of the heart's chambers and major blood vessels. This is an echocardiogram, which is a type of ultrasound of the heart. This is one of the standard views, which can be confusing at first, since the heart is shown upside down and backwards. But with practice, it is easy to recognize the structures. With each beat, we can assess how well the heart is working. Often we want to see if there are any leaks of the mitral valve, so we turn on color Doppler that can then show which direction the blood is flowing. These 3 small images show different ways of looking at the mitral valve. The large image is showing the center small one. Some ultrasound machines can generate 3D images of a valve to show it as though we are looking at it from the inside of the heart. Please see the link in the descriptions if you wish to practice scrolling through full sets of CT images done in various planes. Most of these do not have labels, as those are typically available in still photos. Here's a summary of the topic we just covered. Please pause the video to read this if you wish. If you're interested in practice tests that are similar to state exams, but with detailed, colorful explanations for each answer, then please see our apps in the App Store. Many of these are free and none expire or limit their function. Since we only make educational products for children, none of our apps have third-party advertising, in-app purchasing, or connect to the internet. Please subscribe if you'd like to be notified of future educational videos we make. Thanks for your attention.